Introducing the Zika virus, it's an infectious disease that is mainly transmitted through mosquitoes. The pathogen belongs to the Flavivirus virus family. It's an insect-borne disease, and the reservoir is mostly a female mosquito called Aedes aegypti or Aedes albopictus. These mosquitoes are usually active during daytime, but they can also be active during night. However, the development of Zika virus was first discovered when it was isolated from a rhesus monkey in the forest of Uganda in 1947. Following to that, in 1960, the first human cases were reported in both Asia and Africa. In this day and time, the Zika virus is still considered an endemic in Africa and Southeast Asia because it causes rare cases of acute febrile illness. However, it is now considered an epidemic, which led to the Zika virus causing its first reported largest outbreak in Yap State, Micronesia, in 2007. Followed by the 2007 outbreak, the Zika virus caused two large outbreaks in 2013 and 2015 in both South and Central America as well as the Caribbean. There are still unreported small-scale outbreaks in Southeast Asia, such as Thailand and Indonesia.
Epidemiology of Zika virus infection. According to the WHO, Zika is a mosquito-borne flavivirus that was first identified in Uganda in 1947 in monkeys through a network that monitored yellow fever. It was later identified in humans in 1952 in Uganda and United Republic of Tanzania. So how did Zika enter Malaysia? Sporadic cases of Zika were reported in Malaysia, contrary to the popular belief that Zika only appeared in Malaysia in recent time. A sudden surge in number of Zika cases in 2016 to more than 200 cases in neighboring country Singapore caused a justified panic among Malaysians. Zika was declared a global health emergency in February 2016 by WHO. In September 2016, Malaysian first official Zika cases was reported. A Malaysian woman tested positive for the infection after a visit to Singapore at the time. The woman from the Taman Botanic in Klang, Selangor was admitted to the hospital after she experienced a fever and facial rash for a week after she returned from the Republic. The first local infection was detected soon after when a 61-year-old man from Kota Kinabalu tested positive for the disease. The third confirmed Zika cases was crept up to 8.
So let's see what could be the signs and symptoms of Zika virus. Based on my research, Zika virus may be symptomless or the symptoms can be vague and mild. They last for up to a week. Infection with the Zika virus is rarely severe enough to warrant hospitalization, and it's rare still for an individual to die as a result. So the initial symptoms include fever, rash, muscle and joint pain, conjunctivitis, which is known as red eyes, headache, pain behind the eyes, vomiting. However, complications of Zika can be devastating, especially if a woman contracts the virus while she is pregnant. It can cause a brain defect known as microcephaly in the unborn child. The brain and head of the newborn will be smaller in size than is usual, which is illustrated in figure 1 on the right. It also could cause a loss of pregnancy, stillbirth, and other congenital disabilities. Also, there have been reports of people developing Guillain-Barré syndrome following a Zika virus infection. GBS is a rare but serious autoimmune disorder that affects the central nervous system.
Two main types of tests are used for the diagnosis of Zika, mainly the molecular test and serological test. For the molecular test, the first type of test is the RNA nucleic acid test. In this test, the virus RNA can often be detected during the acute phase of infection and remain up to 14 days after onset of symptoms. Therefore, the test is performed on specimens collected less than 14 days post symptoms onset. Samples used for the RNA nucleic acid test are generally serum and urine specimens. The second type of test is the trioplex real-time RT-PCR assay. This is a test for qualitative detection and differentiation of RNA from Zika virus, dengue virus, and chikungunya virus. The samples used are human sera, whole blood, or cerebrospinal fluid, urine, and amniotic fluid. The nucleic acids are detected by reverse transcriptase polymerase chain reaction. The second type of test is serological test. The first type is the IgM serology. This is preferably performed around day 4 after symptoms onset for up to 12 weeks post-symptom onset. This is because it's the period when the Zika virus specific IgM are at a variable level, facilitating the detection. The test is usually performed in concurrent NAT for symptomatic pregnant women. The second type is the Zika MAC ELISA, which stands for Zika IgM antibody capture enzyme linked immunosorbent assay. This is a qualitative detection of Zika virus IgM antibodies in serum or cerebrospinal fluid. The process: firstly, the anti-IgM is coated on a 96-well plate and the patient's serum is then added. The presence of antigen in the serum is detected by color changes when chromogenic substrate reacts with enzyme conjugated to the antiviral antibody. Spectrophotometer can then be used for further detection of colorimetric results. The third type of test is the plate reduction neutralization test. This test focuses on the ability of the specific antibody to neutralize the virus, hence preventing the virus from causing plaques in a cell monolayer. This is the most sensitive and specific test.
Zika virus transmitted through two main ways, which is direct contact transmission and bodily fluid transmission. Zika virus originates with non-human primates in tropical rainforest but can infect humans. Warm urban environment with pools of water attracts mosquito and can lead to the virus spread. Zika virus is mainly spread by mosquito, which is active mostly in the daytime. Other ways people getting Zika virus is by sexual transmission. Zika can be transmitted from men and women to their sexual partner. Most known cases involve transmission from symptomatic men to women. It can also be spread through pregnancy. Zika virus can be spread by vertical transmission, which is known as mother to child transmission, during either pregnancy or at delivery. Lastly will be through blood transfusion. To date, there have not been any confirmed blood transfusion transmission case in the world.
Now we move on to the Zika virus treatment. So far there is no specific medicines like antiviral treatments or vaccine to treat Zika virus. But there is some treatments that aim to relieve symptoms. For treat these symptoms, first we need to take plenty of rest, drink a lot of fluid to prevent dehydration. Taking medicines like acetaminophen, which is reduce joint pain, and other non-steroidal anti-inflammatory drugs because it can lead to risk of bleeding. If you are taking medicine for other medical condition, remember to talk to your healthcare provider before taking additional medications, and you need to take a doctor advice if the fever becomes worse.
How do we prevent this virus from spreading? Firstly, clean all window screens. Use insect repellent. Avoid wearing dark-colored clothes and opt to wear long-sleeved shirts and trousers instead. Practice sleeping under a bed net. Finally, try to get rid of any stagnant water in old containers, because these are the places where mosquitoes usually breed.